This is a case. This is a case where the patient has an open bite. How do I see it? When I place the upper and lower wax rim together and I tell him bite on the last molar. عد لورا شوي أكثر لسانك سقف حلقك العض عض. You see there is a space between the upper and the lower wax rim. This space is created because of the thickness of the wax posteriorly. So how am I going to adjust this? I need two steps. First of all, I'm going to adjust the wax in the posterior area. So I'm going to place my hot plate on the posterior margin. I'm removing from posteriorly, okay? I'm going to check this inside the patient's mouth. Notice that I'm not touching the anterior. You can see that I'm touching the posterior, not the anterior. The anterior is still solid. So I'm touching and changing the orientation of the occlusal plane. Remember that in the molar areas, the molars are oriented with the retromolar pad, not more. Do you remember that? So that means I need to lower the molar teeth while still keeping the anterior in their place. So I'm reducing posteriorly the height. How do I know where am I from the retromolar pad? I could simply compare with the cast. Okay? So it's telling me I'm coming closer to midway of the retromolar pad area. Now, if I do this adjustment and still it is not closing, okay, and just now I'm touching the anterior, just now. I'm going to touch the anterior at this moment. I'm going to remove all of this wax. Make sure all of the wax is clear from this side. Notice that some of the acrylic now is exposed. If I still have an open bite, I'm going to remove this acrylic. So all of this acrylic going upwards, I'm going to remove it using the trimmer. I'm going to cut it off. And you would say, okay, I'm exposing the retromolar pad. It's okay. Later on, we are going to refill it with the wax substance. If still it's hitting, I also check the upper. I check the upper wax rim. Notice that when you were in third year, we keep asking you to do a bevel posteriorly and expose the tuberosity totally. Don't leave wax over the tuberosity because this is where the lower comes close. So I need to make sure that the tuberosity is exposed. This is not.